This Sunday on Capital Connection, a new surge of COVID-19 hammers Illinois hospitals.
Every time we see an uptick of cases and then upticks of hospitalizations, Dr. Ezike and I are in close touch about what do we need to do next.
The state's top doctor joins us to break it all down.
90% of all the admissions that have happened in the last couple of months have been in the unvaccinated.
Plus, he's a casualty of gerrymandering. House Republican Mike Murphy joins us to explain why he's stepping aside.
I don't think this should be your career.
And why Illinois Republicans on Capitol Hill are drawing battle lines over funding the U.S. military. It's all coming up on Capital Connection.
From the Illinois State Capitol Rotunda, Capitol Bureau Chief Mark Maxwell is asking the tough questions. This is Capital Connection.
Welcome to Capital Connection. I'm Mark Maxwell reporting from the Illinois State House on this Sunday, December 12. Illinois officials are bracing for yet another surge of new COVID patients arriving at hospitals in levels we have not seen for most of 2021. These new infections appear to be Delta variant infections, largely among unvaccinated populations. Yes, there are some breakthrough cases, but those are still in the vast minority. We'll get more from Dr. Ngozi Ezike on that in just a moment as she joins us. But first, Governor Pritzker answered questions from reporters at a press conference on Friday as word emerges from Chicago that health officials in that city are considering imposing new vaccine passport restrictions that would ban unvaccinated people from certain parts of public business.
Dr. Ezike and I are in close touch about what do we need to do next. I want to remind you that in the state of Illinois that we have some of the most stringent mitigations that you can have right now. In fact, we're one of only 6 states that has a mask mandate for indoors, and thank you all for following that today, keeping each other safe. And I know I sound like a broken record, that if you are not vaccinated, please get vaccinated. Please, please get vaccinated. It will keep you safe. And if you have not been boosted with a booster, please go get boosted. It's literally multiple times the protection that you got from the original vaccination.
Dr. Ngozi Ezike joins us now from her offices in Chicago. Can you just start by giving us an overview of where we are? We've seen just 8 ICU beds available in southern Illinois, also north of us in Will and Kankakee County. What does that tell you about where we are right now in Illinois?
Yeah, despite having lots of vaccines in arms, we are seeing that of the millions of people that are still unvaccinated, they are unfortunately finding their way to the hospital. We are seeing that 90% of all the admissions that have happened in the last couple of months have been in the unvaccinated. We are admitting 350 people newly each day to hospitals in our state with COVID. Again, 90% are unvaccinated. And so right now we're in a very uncomfortable surge that is threatening hospital capacity. As you said, Will and Kankakee have 8 beds, and that's almost, that's a population of, I think, maybe 800,000 in those counties, and Region 5 is on the brink again. So we really want to protect hospital resources so that if anyone needs to go to the hospital, vaccinated or not, for COVID or not, for a heart attack, a broken leg, appendicitis, we want everybody to be able to get that care that they need.
That is one of the perhaps underreported aspects of COVID-19 is the secondary effect. We've seen reports from family members who've said their elderly parents, grandparents are putting off what are technically elective surgeries sometimes. Sometimes there are other effects that could even be life-threatening, but they just can't get space in a hospital because some of these other beds are taken up. That's still happening at this point in the pandemic. How does that overall calculation of hospital capacity affect your policy decision-making? There are some people that look to bigger states. Many of them are progressive states, Massachusetts or New York, where health experts who supported and called for immediate mandatory mask mandates early on are now saying we have other tools at our disposal. Do you think the mask still helps ease pressure on hospitals, or why do we still have that in place?
I think we have some data to really support that these masks have been helpful. We have, when we look at our neighboring states and extending that neighbor, pretty broadly to include like 12 or 14 states around us, we all have good vaccination rates. Of course, we are a little bit higher than all of the, 12, 14 neighboring states, What really distinguishes us is that we have a lower mortality rate. And so I really think that's where it's at. We want less people to die of COVID, and we have the lowest rate, not even by close, but it's pretty big gap between us and the other 12 or 14 states around us. And so really, everybody is vaccinating, a lot of our residents. I think one of the big differences is that we have been able to slow, no matter what you think, masks do slow down transmission. And so even though everyone is not doing it 100% of the time in every nook and cranny of our state, the mask wearing that has happened has slowed transmission down so that less people are dying of COVID. And I'm very, very happy to report that.
Interesting. Top officials at University of Illinois just recently notified staff and students this last week that they strongly encourage them to get their third booster shot before returning to school in the spring semester, just after the holidays. That's not much time from now. Do you think at some point in the near future the definition of fully vaccinated will expand to include that third shot?
So we're having those discussions now with the CDC director, Dr. Rochelle Walensky. She's been a great leader and talks frequently to the state health directors. And this is the conversation that is happening as we learn more and more, as we see these different variants and see that you need more of that antibody protection to help fight off these evolving variants. That's a possibility. Right now, the definition has not changed. But again, as we know, everything in this pandemic is evolving and being updated rapidly.
And yet there are still some counties with abysmal vaccination rates and records. In Vermilion County, for example, farther south. I wonder if there are people there who are staring down this question, wondering, should I go get that first shot? Maybe they've already been infected. They think they have antibodies. They have some protection. What is the level of protection that a vaccine gives me versus prior infection? Are there studies that tell us that a vaccine provides us X amount of protection versus Y?
Yeah, so we are seeing that, obviously, if you are vaccinated, boosted, and had the actual infection, like you are in the best position. But we do have a growing number of studies that are showing that people who have natural immunity, of course, that provides protection, but it is not maybe as strong as the protection that you might be getting by being vaccinated and boosted. And of course, having a natural infection, depending on how symptomatic you were, how much, you were ill, some people had mild symptoms. And so did they develop that full antibody response? We have seen people with natural infection get infected again and reinfected. So we know that that is not like a blanket protection that makes you just immune to have any future infections. So we continue to say that vaccine immunity will give you the highest level of protection. And so we encourage people, even if they've been infected, to please get vaccinated.
We've had the vaccine available for just about a year now. It was about a year ago when you and Governor Pritzker were there as the very first healthcare workers got the first doses of the vaccine. Since then, the vaccine has proved incredibly popular in Illinois. Roughly 4 in 5 people who are eligible to get the vaccine have it. But I wonder why, if so many people in Illinois are vaccinated, why are we still seeing so many breakthrough cases?
Yeah, so when you think about the number of people who are still susceptible and who are still able to get the infection and have those variants occur, there's still a lot of people, millions of people in our state. And then you have to remember that this is a bigger than just Illinois. This is, an international situation where, these variants are developing in all different parts of the world. I know we've, described California variants and New York variants, but they're coming out of other countries too. And so this vaccination effort is not just an Illinois or US effort, it's actually a global effort. And so we need the whole world to get vaccinated to slow the evolution into these dangerous variants.
Once a variant emerges, how long does it take experts to accurately describe the severity of the risk? Like, for example, the Omicron variant arriving, what exact risk does that present to people vaccinated or otherwise? We just detected the first case of the Omicron variant in Illinois. Will a mask protect a person from that kind of spread? How will a vaccine protect a person from this new variant? Do we know that yet?
There's certain things that we know because we understand, virology. And so we know that we expect that the vaccines will offer for sure some measure of protection. They're doing studies now to figure out how much. Like, we expect that each subsequent variant will be able to evade the immunity by a little bit. So how much is that little bit, or is it a lot? That's what the researchers are doing now. And that's why the boosting will level us up and give us more antibodies, because the more fighters we have in our blood, that can overwhelm the Omicron variant. So we know that masks are another line of defense. We know that washing our hands, like, those things won't change. We are going to vaccinate, boost, wash our hands, wear our mask. Those are all strategies that have been proven to be effective. We will get more details. Every day we're getting more information. I have colleagues in South Africa that we figure out the time zone difference, and then I can call in the middle of the night to catch them in their mornings to see, like, what are you seeing there? So we are going to get information. We'll continue to get information, and we'll continue to educate the public so that they have the most current, up-to-date information.
All right, well, before we run out of time, and I appreciate you joining us, I do wonder, as families prepare to celebrate the holidays this year, some of them reuniting with maybe elderly family they have not seen in a while, what advice, what words of wisdom would you have for them on how to do that safely?
Yeah, so everyone has their own, personal level of comfort, personal level of risk tolerance, obviously. And so you have to be respectful of those ideas. Obviously, it's not too late to get boosted. The boosting, you get to that higher level of immunity in less than a week. So it's still time before people are getting together. If they're celebrating Christmas or New Year's, there's still plenty of time to get boosted. Obviously, get vaccinated. Get that first shot if you haven't gotten vaccinated. If you're in a setting where there'll be many people, an indoor space, if it's possible to crack open windows, open doors, get a HEPA filter. That's an effective environmental tool that can help limit transmission. And if people are able to wear a mask, if it's a completely mixed crowd and you don't know who all the people that are there and you're not clear and you feel more comfortable wearing your mask, don't be inhibited from wearing your mask when you're not actively eating or drinking. But really, we know what to do. We're not new to this anymore. And so I think people can make decisions that are in their best interest, in the interest of themselves and their communities.
All right, Dr. Ngozi Ezike, in for a busy stretch this holiday season. Thank you for joining us.
Same to you. Thank you.
We're back in a moment with a casualty of gerrymandering. House Republican Mike Murphy explains his decision to step away when we come back.